Some alarming new numbers from the city's health department show that people who live in public housing have died from COVID at a higher rate than the rest of the city.
CBS 2's Bauman has more now on the troubling data.
The Johnson houses in Harlem has been one of the harder hit communities in the pandemic. At least 12 residents died from COVID at its height.
We've lost a lot of people here in this development from the COVID.
Newly released data from the health department shows 7% of the people who've died from COVID citywide through June of this year lived in public housing, or NYCHA. But NYCHA residents only make up 4% of the city's overall population.
COVID's shining a light on healthcare disparities. We've known that they've been existing, and now we're seeing it with the disproportionate death rates in African Americans, Afro-Latinos, and people in inner city areas.
Dr. Daniel LaRoche says the prevalence of pre-existing conditions in communities of color, now mixed with vaccine hesitancy, may be to blame. He's been trying to combat vaccine mistrust with his own patients in Harlem.
We have to surge education and outreach efforts.
A health department spokesman told us in a statement, transparency is a cornerstone of the response. Helping all of us understand the scope of loss is a critical component of our recovery.
They should be making sure people get the vaccine.
I'm a diabetic, so I didn't really want to get vaccinated, but I didn't want to get corona.
Health department data shows while there is a death rate disparity, the overall number of COVID cases among NYCHA residents is on par with the city average.
Getting the vaccine is the most important thing you can do.
A NYCHA spokesman told us it's followed health guidance from day one to keep buildings and residents as safe as possible. In Harlem, Bauman, CBS 2 News.